Welcome to the BioBalance Healthcast, episode 680. Weight loss medication's biggest side effect.
BioBalance Healthcast features conversations about anti-aging medicine. Your host is Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging. Dr. Maupin is the author of The Secret Female Hormone, the seminal work about testosterone replacement therapy for women, and Got Testosterone, the award-winning book for men that helps men choose the most effective and safe form of testosterone replacement. These books are available on Amazon or from Dr. Maupin's office at BioBalance Health in St. Louis and in Kansas City. Dr. Maupin's office is currently accepting new patients.
Welcome to the BioBalance Healthcast. Today I'm going to talk about the weight loss drugs that have become so popular in the last several years. They're very effective. They're called GLP-1 inhibitors, and the names are Ozempic, Wegovy, Mounjaro, and Zepbound. And these four drugs, or the compounded drugs that are like them, are very effective, very safe. I have to reiterate that people who either can't afford it or don't like taking drugs or don't like taking medications really should look into this if they are overweight. If your BMI is greater than 30, your insurance will probably pay for it for weight loss. If you have diabetes and are overweight, your insurance may pay for it as well. If you're not, then you can find a doctor like us who gets compounded medication that's exactly like this that you can draw up yourself. It doesn't have a pen like these do, but you can draw it up yourself and give yourself the injection and get the exact same thing and lose the weight you need to lose and become your ideal weight. Why is that important? These drugs are important not just because we're talking about everybody looking better or losing a size. I'm talking as a doctor about health. If you get to ideal weight, you decrease your risk of heart disease. You decrease your risk of stroke. You decrease your risk of having any kind of cancer. All cancers are related to blood sugar and obesity. Obesity causes inflammation. It derails your immune system, and so those cancer cells get by it and become a problem. If you can get to ideal weight, lower your blood sugar, these drugs do that. If you can get there and stay there, then you should use these drugs to be healthy. Honestly, it's the second most important find in the last 20 years. The first most important find was that testosterone should be used by women and men as we age. So that's number one. This is number two. Both of these keep you healthier and active and productive as you go through the aging process. So, why am I talking about this? Not just to tell you that you should use these medications, but if you are using these medications, the biggest side effect I hear about and talk about all the time is something called GERD. GERD is also called reflux. It's also called acid indigestion. And the symptoms that you have aren't probably what you think. The symptoms are this dry, little hacky cough, especially if you lie down or you recline and start coughing. That is actually the response of acid going all the way up and irritating your throat and causing a cough. So your acid isn't just going from your stomach up here, it's going all the way up. And it is irritating your esophagus. You're not supposed to have that much acid in your esophagus. It wasn't built for that. So your response will be a constant recurrent hacking cough, or you're going to have difficulty swallowing. Sometimes it makes you feel like you can't get food down your esophagus. You may have asthmatic symptoms, feel like you're having an asthmatic attack if you've ever had one of those, and you'll have a bad taste in your mouth. It'll taste bad, you'll have bad breath. It is not something that you want to have both for yourself. All of these things are really irritating and not good for you. So this is one of the biggest side effects to these medications. Why is that a side effect? Well, one of the ways is this medication has multiple ways to work inside your body to keep you from eating too much, being hungry. But the one thing it does do to help you feel full longer is to stop your stomach from emptying fast. So you eat and your stomach was full and it's emptying into your small intestine over here. And as your stomach does that, it lowers, it doesn't push upward through your diaphragm to let acid in. It should normally just go one direction, down. And as your food goes down, the acid that was in your stomach goes into your small intestine. It can handle it. Your esophagus can't. So if you are full longer, this drug makes you feel full longer, your stomach is distended and full longer, then it's more likely that it's going to go back up. And especially if you don't do the one thing I tell all my patients to do. If you're on this drug, you need to stop eating when you feel full. That's it. No more food. Don't eat past full. In fact, that's a really good thing for all of us to do. When you're full, even if it tastes good, stop eating. Because if you overeat, if you eat too much, even if you're not on this medication, your stomach's going to be over full and it's going to start pushing up into your esophagus. That can cause many problems in terms of irritation, bleeding ulcers. All of these things are bad. You don't want them. But if you're on this medication, it's much more likely that you'll have that happen because your stomach stays fuller longer, even if you don't eat a lot. So that's what is happening. Women have more of this than men. Many of us who have had children, or many women who are really overweight and have all this pressure in their belly, the diaphragm is a muscle that goes across right here, right there. Your lungs are above it, your intestines are below it. There's a hole like this. In that hole is your esophagus. And your diaphragm is a muscle that interlocks around that hole. So your diaphragm is always trying to hold that esophagus in place, and it acts like a sphincter. It kind of holds the food down below the diaphragm, down here. That's its job. But when you become obese, you stretch that hole. When you become pregnant, you stretch that hole, and your stomach sometimes even pushes into your chest. Doesn't feel good. That's called a hiatal hernia. It can come back down if you lose weight or if you're not pregnant, but you still have this distended opening where acid can come up and you don't have that sphincter activity that holds the acid below in the stomach. So pregnancy, being overweight, both things that can cause this to occur or occur more than it would in somebody else who's never had a baby, never been overweight. Some of us just have a hiatal hernia that is a birth. It comes from birth. It can be developmental or it can be genetic. So doctors call this acid reflux. And usually, in fact, the first time I had it, I was on the phone with my daughter who was in medical school. And she heard, actually my husband was on the phone, and she heard me coughing in the background. She goes, "When did Mom get GERD?" I mean, honestly, I'd been a doctor a long time. I didn't even think that cough was GERD. It is. It was. So I started on an antacid like Gaviscon or Pepcid, and it went away. So that's like the first line of treatment. It's over the counter. It decreases the acid in your stomach so that it doesn't irritate you and it doesn't irritate your throat. So one of the things that you should know, especially if you're on these medications, is that you should eat foods that prevent acid reflux. Okay, so change your diet. So foods that prevent acid reflux include fibrous foods like vegetables, salads, things like that, and don't overeat them. Stop when you're full. Then alkaline foods are, in other words, not acid foods. Acid foods are like oranges and vinegar and that kind of lemons. Any kind of citrus food is going to cause you to have more acid in your stomach. I like alkalinizing water. So there are several different companies that offer home alkalinizers, and they alkalinize your water. So anything you drink or anything that has water in it, anything you cook that has water in it will have alkaline water, not acid water, and that will help neutralize the acid in your stomach. So it's not as damaging to your esophagus. So that's something really good to do. Some people say milk helps acid reflux. Some people say it makes it worse. It depends. That to me means some people get worse and some people get better. You won't know until you try it. But the foods that you should avoid are acid foods that will trigger this and make it worse. So tomato sauce and tomatoes are the worst producers of acid. So that's all your Italian food. Fast foods with a lot of fat in them and greasy foods, that usually causes some of this. Fried food, citrus drinks, orange juice, grapefruit juice, or any of the citrus type foods. Soda. Soda is very acidic, and soda is going to make this a lot worse. Whether it be diet or not diet, it has an acid in it. Caffeine stimulates the production of acid. Chocolate stimulates the production of acid. Garlic. I'm Italian. We have garlic in everything. Garlic stimulates acid. So do onions and mint. Have you ever had that feeling and then you don't have any medicine, so you just take a mint? That makes it worse. Don't do that. And and in the end, alcohol. Even if it's not mixed with anything that's acidic, alcohol does that. So sometimes we don't even need a medication. So here are some things you can do that are herbal. You can take licorice, real licorice. So that's like black licorice. Chamomile tea. That's going to neutralize the acid. Marshmallows. I'm not so sure about that because that has so much sugar. Sugar stimulates acid. I'm not sure that would be a great idea, but they think it does. This is in the research. And there's something called slippery elm. My mother used to have those, and she used to have reflux and take these slippery elm. I thought she had like a chronic cough from COPD or something, but she didn't. It was this. So she took slippery elm, and that helped. It doesn't taste very good, so I don't really prefer it. But if you don't care about taste, it would help. Drinks that help are non-milk based drinks that don't have milk in them, coconut water or alkalinized water, like I said earlier. But if it's not about choice of food, it's about lifestyle, you should eat smaller meals. So smaller meals means you're not going to feel really full when you're done, and you're going to eat slowly. If you eat slowly, you give it your chance for your stomach to empty. Now, with the GLP-1 medications, your stomach's still not going to empty. So I don't think that is going to be helpful. Sleep on your left side. So if you sleep on your left side for some reason, that helps the esophagus keep the acid in the stomach. I can't control how I sleep, so that's a little difficult for me. But if you can elevate the head of your bed, that's the most common recommendation. Put pillows under your back, or if you have one of the beds that you can increase the angle, like for snoring, it works for this too. So you can sleep with your head tilted up. Chew your food very well. The more you chew your food, the less acid it's going to stimulate. And then stop smoking. Smoking's really bad for acid reflux. I didn't say, but should have said, anything that has hot sauce, hot chilies, Indian food, all of that stuff is going to make all this worse. So you have to kind of stop your using that. You should increase your high protein meals. So in this case, meat is not a bad thing. Meat, cheese, eggs, all good, and they will all help you with losing weight too. But anything that has sugar in it is going to make this worse. Home remedies. You can take this I'll tell you the ones I like. I like the probiotics. I think everyone should take probiotics because that makes the intestinal flora or the intestinal bacteria healthier. So if you take probiotics, you're less likely to have this reflux. If you chew gum, not mint gum, but another type of gum, that actually alkalinizes the saliva, and so that helps your stomach counteract the acid. Acid base. Acid is what makes this worse, and base or alkaline makes it better. So you want to alkalinize your food or what you're taking in. So aloe vera actually helps. Bananas, I don't advise that for people on a weight loss diet because it has too much sugar. It's the only fruit that I tell people to eat half of, not the whole thing. Decrease the dose. And you can have some baking soda. Baking soda is alkaline. It normalizes acid. So baking soda and water, teaspoon of baking soda and a glass of water would help you with this. That's kind of the basis of some of those old-fashioned medications that were sold at the drugstore. So ginger is one of the foods that you can also add. Ginger, like you get at the Asian food store that they use for sushi. It's been soaked and sliced, and you can chew on that, and that does really help. Honey, believe it or not, and don't eat too much honey because it's very high in sugar, but eat a teaspoon of honey, and that will help neutralize this. If you're somewhere where you don't have access to medications, this would be a way to use foods as a medication. And vegetables really help. Bananas, apples, grapes, and all the melons and pears help. Some of the vegetables that help are broccoli, cauliflower, carrots, corn, cucumbers, ginger, green beans, green peppers. I usually eat green peppers raw, like an apple. Potatoes and sweet potatoes all help. They don't make it worse. Now, what are the treatments for this? So you can go to the store and there's all these. If you have an ulcer, if you have called antacids, so they're available over the counter, and they are meant for short-term reflux. When you're taking this medication, it's not usually forever that you're at a dose that's going to cause you to have this GERD. So it is a short-term. And my advice would be to start with this and not a prescription medication, but start with your diet, start with your lifestyle changes. If that doesn't work, then you need to have take something called an H2 blocker. It's a histamine blocker. We call it Pepcid, Tagamet, and Gaviscon. So these are the three most common drugs that people take for acid reflux or for ulcers. And they're very safe. You can take a Pepcid in the morning that will work all day long and not have really no side effects. And then you can have a chewable Pepcid, take a chewable Pepcid after dinner and before you go to bed. That's very helpful. Remember, more time between eating and going to bed is helpful with this because the fuller your stomach, the worse it is. I promise I've experienced that. Late night meals. Now, if the H2 blockers don't work, then there's a short-term therapy that many doctors take to an extreme, and that they are called PPIs. The most common is omeprazole, and they should only be used for 2 weeks. They should not be used for long-term. In many ways, they're counterproductive. They do stop the acid, but then they decrease your ability to absorb nutrients from your food or vitamins or medicines. I mean, in general, all medicines are meant to be in a somewhat acidic environment so that you can absorb them. It precludes that. There are many people I've had to take off that so that they could absorb the medications they were on and have it do some good. But so 2 weeks, and then stop it and go to the H2 inhibitors, because those are like the Tagamet or Pepcid. So I just don't want you to have the advice that you go on omeprazole and stay on it. It's not that. It wasn't meant for that. It was meant for short term. So if you have GERD and your GERD doesn't go away with any of these, you need to see a GI doctor. And the GI doctor needs to look down there and see what the heck's going on. Do you have an ulcer? It would be a whole different kind of treatment. You know, even if you're on these medications, you can go see a GI doctor to see if there's something really causing this problem that is fixable, that can be taken care of by a GI doctor. They usually will put you on the omeprazole for a longer time. I don't recommend that, but if that's the only thing that makes you better, that would be okay. And in the very end, you would have to go off the GLP-1 inhibitors or decrease your dose. Dosage does matter. So if you decrease your dose, that might stop the problem. So this is the biggest or most common side effect that I hear about in my patients for weight loss. I think weight loss is necessary for 50% of the population in America. We need to stop eating so much and stop eating processed foods and stop eating fatty, sugary foods. But this is the side effect that I most deal with in our patients that do this. I commend them for trying to lose weight and trying to be healthy. I just am trying to help them with any of the little things that might stop them from taking this medicine. So if this is you, I hope you listened. You can read my blog. It'll have all of these things listed. And then I hope this can help you tolerate your medication. Thanks for listening.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. You can find Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth.